Hello, everyone. My name is Jacqui Main. I'm an exercise physiologist from Active Health Clinic in Melbourne, Australia. And today I am going to be talking about tools and strategies for pregnancy around childbirth and postpartum care in EDS and HSD. I have no disclosures to report for this presentation. So this presentation is for information only and nothing should be substituted for individual assessment and treatment or medical advice. For the purpose of this presentation, I will refer to pregnant, intrapartum and postpartum individuals as they or individual in respect to the LGBTQ2SIA+ community. So my information sources are from my own personal experience, which I'll give a little bit of a rundown in a moment, my own clinical experience, and speaking with people with a variety of experience and expertise in the area of hEDS and HSD, some people who have experienced more than one successful pregnancy living with these conditions, but also some healthcare professionals and some academics. I've really loved looking and learning from hEDStogether.com, EDS UK, and lots of published research, which is stated in my references. So I am a single mum of a 3-year-old little boy who has inherited my connective tissue disorder. I'm going to leave discussions of labour and birth to the other amazing practitioners talking today, Dr. Sally Pizarro and Dr. Melissa Russo. So early in my pregnancy, I had some bleeding, which was obviously quite concerning considering I'd had a couple of miscarriages before that, which is, within the research we see is unfortunately somewhat common in this population. I had a lot of first trimester pain, which was a bit of a surprise, with pelvic girdle pain, pubic symphysis pain, and I had a lot of rib pain accompanied by nerve pain. I had reflux, I had fatigue, which, as I describe as, people who are pregnant without invisible illnesses experience quite a significant amount of fatigue. So living with fatigue for quite a lot of my life, it was like, I think that's a bit normal. My POTS, I felt really, really good. That increased blood volume was a wonderful thing. Complications around constipation and varicosities with that. My bub was a breech presentation. Attempting to turn him was unsuccessful, so I had to have a cesarean section, which I had a lot of anxieties about considering I have had a history of CSF leaks, so I was not keen to have something put into my spine. And I had some positives of all of that, though. Looking at, I spent 4 days in hospital, which was really important to have some feeding issues initially. My little boy, unfortunately, needed to be resuscitated for 7 minutes, which from my research, I have seen that is somewhat common in some of our bubs that inherit these connective tissue issues from their parent. But it was great to just be supported by nursing staff, lactation consultants, not have to worry about all of the things around home. And then I actually spent 3 weeks with my parents, actually away from where I lived. And I found that really beneficial as well, as I wasn't inundated by visitors. And that gave me a really great opportunity to bond with my bub, get through those, the really hard yards initially where bub's sleep is reversed. They're awake at night and they sleep during the day, and just having that support from my parents. The pain from a cesarean section and that rib pain was still there postpartum. Cesarean section was definitely difficult to recover from, but something that I've learnt from. I wish I had have done a lot more exercise and movement that could have helped me through that process. So kicking things off, so hEDS and HSD affects approximately 1 in 20 pregnancies globally. So when we think about those numbers, like we say, is that these conditions are not rare, they're just rarely diagnosed. And I think this is something that's quite obvious here. So childbearing with these conditions, we generally will experience a fairly low risk pregnancy, but then we can experience significant issues or anything in between. And that's why we've all got to be treated as individuals. We do know that there's risks a bit higher with vascular, classical-like and classical EDS. So there is that extra care that may be needed. So I'm going to jump into some pregnancy considerations. So due to hormonal changes, which we all tend to deal with day in and day out, but with pregnancy, that increase in progesterone actually alters our blood vessel constriction. So we don't have that extra ability for the vessels to constrict, even though we're already lacking that with dysfunctional connective tissue. So we may experience an increase in some symptoms or severity of symptoms. And this is why it is so important, and why I am here today and so passionate about this, is the more knowledge that you have as parents that you can pass on to your medical team and advocate for yourself. Our obstetricians, midwives, GPs, whoever's involved in your team can know everything possible about your journey ahead. So some common complaints during pregnancy. So our hormones play a key factor here. So in preparing our smooth muscle and connective tissues to grow and birth a baby. So therefore, it's pretty logical that we're going to have potentially a few issues going along here. So varicosities, so this includes varicose veins, hemorrhoids, and blood vessel issues through the vulva. So because our blood volume increases during pregnancy, and it's pretty significant, so 20% to 100%, this is why sometimes people with POTS can feel a lot better, because we've got that bigger blood volume. But even within that first trimester, you may start to notice some spider veins popping up in the legs or around the lower body. So if we think about, our blood vessels are more like a balloon than a PVC pipe. So in Australia here, that's just some of the drainage pipes that are in our houses. So as we know, with that increased blood volume on stretchy tissues, it's going to lead to them being under a lot of strain and a lot of stress. The veins in the legs are going to be under more stress, so hence why we will see more of these varicosities in the lower part of the body. And those weakened vessel walls can't always handle that increase in blood pressure. So from an exercise perspective, we know that this is going to impact pain and comfort levels, particularly with those vulval varicosities. That's not going to be a nice thing to experience. So we want to make sure, so our pelvic floor exercises will help improve circulation. We want to be avoiding standing for long periods, which is only going to draw that pressure down further, and lifting any heavy objects. So I've got a few management strategies here. So we want to elevate our legs when sitting so we can prevent that blood pooling into the lower legs, avoiding crossing at our ankles and even our knees, because we don't want to put any more compression on those vessels. Gentle exercise is always going to really help, even though we might not feel like it. We want to keep that blood flow moving throughout the body. And there's some really nice, simple passive leg exercises and pelvic floor exercises that you can do. The support tights, as we all know and probably wear, just helps to keep that blood flow up towards the trunk. A healthy diet and good fluids is obviously going to help prevent constipation and therefore straining. And from my pictures here, you'll see our toilet posture is really important, so that we're actually having our bowel movements, not having to move through lots of kinks. It can pass through at a much more gentle pace. And then there's obviously some conservative gentle laxatives and creams that can help with the pain that might be happening with these issues. Heartburn, I myself lived on Gaviscon. So during pregnancy, that progesterone again just is going to contribute to the muscles in the esophagus, including that lower esophageal sphincter, which is just where our esophagus meets our stomach. It's going to relax more, which means that we have more of our stomach contents that can rise up. And then as bub grows a lot bigger, we're going to experience that a lot more. So we want to make sure that small regular meals, staying upright, no late meals. I've put a few triggering foods here, and using pillows and wedges to elevate the upper body as well. So we won't do any lying down type exercises when somebody's experiencing this. That swelling in the lower body, again, that compression wear, but we can also experience carpal tunnel syndrome. And I'm always really concerned when individuals may rush off to a hand surgeon and get carpal tunnel surgery, when it is something that once bub arrives, that swelling will settle down. But there's some splints and simple exercises that we can do to help that. Headaches, again, due to that lovely progesterone and an increase in blood volume, and dips in our low blood sugar. So we want to make sure small, frequent meals, maintaining blood sugar, but nasal congestion. So I experienced pregnancy rhinitis, and I thought I had the worst cold in my life, but some nasal sprays, steam inhalation, bed head elevation was a really nice thing to help relieve that until that resolves. Exercise considerations, again, nothing where we're lying down, nothing where we're breath holding and straining that will increase that pressure to the head. Heavy weights, we will monitor your heart rate and your blood pressure, and we just want to make sure we're well hydrated. Nausea and vomiting, again, progesterone levels can contribute to this. So, and we want to make sure, again, it's around our eating, the types of things we're eating, but with vertigo. So if you think about, think connective tissue, it's just everywhere over our body, including our ears, which is our balance mechanism. So this is where we can get that vertigo and tinnitus, so that ringing in our ears. Again, we won't have you lying down doing any exercises with this. We're cautious about your reduced balance and proprioception, choosing the right parts of the day if you do notice some patterns to that nausea and vomiting. Sleep is difficult for any person with EDS and HSD, but it can be worse in pregnancy because of all of the above mentioned issues. So we can improve this by, pain remedies, light bedding and a cool fan. I had a fan on my entire pregnancy, even though my little boy was a winter baby. And white noise can be really helpful for that tinnitus, just to drown out that noise, and using heat packs and pillows. So as you'll see here in this top picture here on the right, I actually slept with pillows behind me. One, because we don't want to be rolling onto our back after a certain period of being pregnant, but two, we don't want to have that excess pressure on our hips. So it was a really nice way just to be able to roll off my hip, but not be on my back for long periods. And this bottom picture here is generally still how I sleep every night. So I sleep with my legs bent, so I've always used a triangle pillow, and due to shoulder dislocations and things, that cuddling of the pillow places the shoulder in a much nicer position with a really good ergonomic pillow. So if I was to draw a line down the middle of my body here, you can see that everything's quite aligned. Pelvic girdle pain, we all know, is quite disabling, so it affects 1 in 5 pregnant women. However, with the EDS and HSD population, so the research has shown that, this goes from 7% in our general population to 26% in EDS. So your symptoms, you will often feel it's difficult with walking, bending, climbing stairs, so anything that's single leg, but rolling over in bed as well. So we want to make sure that we're picking up on this really early, and you're attending some physiotherapy or physical therapy really early on, because this pain will start in the first trimester of people with EDS and HSD, versus general population, it can start a little bit later. And this is this importance, and I will stress, and the thing I wish I had have done was that strength and conditioning as much as possible. So yeah, just going on here. So pelvic girdle pain is actually a biomechanical joint problem, not so much of like we've heard in the past of it being hormones and relaxin, so the hormonal issues. It generally tends to be more biomechanical. So there's often a stiffness in a certain area, which then there's other joints that are overcompensating. So this picture here shows some common painful areas. And some people will actually end up, potentially on crutches or in wheelchairs, which is, really debilitating. I have put some positions down here that women will often find is quite comfortable to labour in. Pubic symphysis pain for me was very debilitating, and that was mostly getting in and out of the car, rolling over in bed. These little hip cushions are really great. So what we want to do to stabilize the pubic symphysis when we're rolling over, that cushion between our knees, we give a little squeeze as we roll, and that helps to stabilize the joint. Sacroiliac joint belts. So we shouldn't be wearing these without proper assessment. And these are really great because we can have one side of the pelvis that's more unstable than the other. So you can tension one side more than the other. Here's a list of some management strategies. So we want to avoid anything single leg. There's many pelvic, so pregnancy type pillows out there. Again, not crossing the legs, cautious with lifting, and just using all of those supports that you can around your body. Getting in and out of the car, it's an automatic thing where we just swing that leg out, putting a plastic bag on the chair, on the car seat, and being able to swivel around and getting out with both feet so that you're not disrupting that pubic symphysis or your pelvic girdle pain. So pacing of our daily activities can really help with what's going on. And this is something that is a real strong point with us in our clinic, where we use a lot of activity diaries, encouraging patients to look at, making their day look like a rainbow. So a mix of high, medium and low demand activities, whether that is fatigue, pain or other symptoms that you will have. Lots of supportive cushions, pain education, TENS machines, which can help regulate the nerves that carry pain messages from the pelvis, mindfulness to calm the nervous system, and we know how much warmth is really important. Coccydynia, this was really interesting when I looked at the research, and I'd wondered what this pain was ever since I had my son. So pain at the coccyx, and what a lot of people will notice, it's actually pain when they go to get up from a chair or get up from sitting, and it's something that just grabs really harshly. So having a really supportive cushion to sit on, that sacrum doesn't have that pressure on it, will help to relieve that pain or prevent it from building up, particularly when we're breastfeeding for long periods of a time. So exercise guidelines I'm going to run through. So you want to make sure that you're having seeing a trained health professional about this and having an individualized assessment. So I've got a range of exercises here. So please make sure you don't try these at home without seeing somebody first. But primarily we want to be looking at, proprioception, isometric, so just very gentle contractions, because they have an analgesic effect in terms of relieving pain. So we want to make sure that our feet are always side by side, nothing that's really too single leg. So even with these hip abduction type exercises on this right hand side here, hip extension down the bottom here, we really want to make sure that they're very short range type exercises. In terms of stretches and mobility, here again, some really nice postures. We can see that we've got you know, our head elevated, not being in positions for too long, really working on some thoracic mobility, using tennis balls for massage in areas. Being pregnant, you've got that belly, we can't often move very well with. Obviously, with this back stretch here, we've got to be cautious of shoulder dislocations and things, but we can actually modify the position of your elbows as well. So my postpartum tips and care, which is where I'm really passionate about. So as a friend said to me, it's kind of like ergonomics for a postpartum care. So helping your body recover, really important to pelvic floor and wearing pregnancy recovery, which you can get from multiple different companies. So we just want to make sure that our body and our connective tissue and our blood vessels are getting the most support that they can. Breastfeeding posture. So we want to reduce that neck and lower back pain. So having some supportive cushions like that coccyx cushion, supporting your arms. So we should feel that you've got enough kind of cushions that your shoulders and everything can be relaxed, and bub will sit quite nicely there without rolling off, and be able to latch quite well. And your arms are there pretty much just as a barrier. As beautiful as our bubs are, we don't want to be looking down at them all of the time, because that will create that pain. So we want to maybe make sure, you know, you can pop a TV show on or chat to a friend. But once bub is latched, you know, making sure that you're taking that time to just relax and enjoy as much as possible being a new mum. Sorry, I will go back. Side-lying breastfeeding, one of the best things I ever did. I found it really relaxing and enjoyable, but also really helped with all taking the load off my body and those postures as well. Breast changes. So the more hyperelastic your skin is, means that we might have some issues with attachment, but that's where lactation consultants are going to be really important. But also we want to make sure that we're choosing the right kind of bras to wear, you know, thicker straps. We've got to think about, we don't want anything dragging through these upper shoulder areas, which can contribute to neck pain and some headaches. You will experience engorgement. So when your milk comes in, which is really uncomfortable. And even though there's the old wives' tale of cabbage leaves, it's not so much about the cabbage, it's about the cold. So there's some really great products on the market now that you can keep in the fridge or freezer. Prams, this is a big thing I'm quite passionate about as well, is that we want to have a pram that is not, you know, top of the market bee's knees. We want it to be lightweight, easily foldable if you're lifting it in and out of the car, and where you can have, again, a good ergonomic posture. So relaxed shoulders. As in these pictures here, you'll see the different heights of my pram, and you can see that angle in my elbows. We don't want something that's going to have our shoulders hunched up, or where we're going to be dragging down. I really loved this pram here in this top right corner here, with it had the wheels on it. So making sure you're taking a good look at those. Changing bub's nappy. So again, change tables, excuse me, not so much about, you know, what looks pretty for the nursery. It's about that functionality. So having lots of, you know, little canisters and containers that are within easy reach. So we're not bending, we're not overreaching. Everything is within a nice, easy reach. Similarly, lifting bub in and out of the cot. So when they're little, obviously the mattress is going to be up higher and they're lighter, but as they get heavier and bigger, we drop the mattress down and they're heavier, so it's going to be more difficult. So you want to have bub as close to your body as possible. You'll see in this second picture here, you'll see my knees are quite hard pressed up kind of against the cot. And what that does is it gives me a lever to leverage against to control putting bub down. So it means that we're not putting all of that pressure through your back and through your shoulders. And then when you're rising up, so bub's been put down, putting your arm on the edge of the cot to give your back that extra support in coming up. Bassinets. I've just put this picture here on the left-hand side, as I don't tend to like these. They can seem like they're handy. Bub's right there close to you. But if we think about rolling over and trying to lift bub out, that's too much twisting. I had this middle one here. So I think anything that's really great on wheels, you can maneuver around the house to where you are. You can be in a comfy chair if you're needing to rock bub a little bit, rather than being stuck, say, in the nursery or in the bedroom where you're not in the best postures either. So we want something that's quite lightweight and portable. Bath time, really important, either having something that's a really nice height, but I like ones that are quite portable, that you can have near maybe the kitchen sink, and then it's easy to empty them out. So there's no lifting of big heavy tubs full of water. You can get bathtubs with inbuilt seats, or you can buy these nice portable seats. And again, that's less where you're having to lean in and hold and support bub when they're really little and they don't have that control. So thinking about those aspects around your house. With carrying, again, you want to be choosing something. So like these 3 pictures here, we can see how broad the straps are. So we want to be able to disperse that weight across the body. So the more we can across the whole back and down across the shoulders and the arms, we're going to disperse the weight. Although Ergo Baby, very popular brand, is good as well, because it's got multiple straps across the thoracic spine and a nice big thick one across the lower back. I would highly recommend trialing them out before buying. Same with car seats. You know, you want to be getting something that's not heavy and cumbersome. Obviously, safety for bub is most important. But what I've recently learned about is this one in the middle, this Even Flow, is a new type of car seat that's actually on a swivel. So we know how hard it can be, you know, just to twist and torsion your body to put bub in and out of car seats. This one is actually on a swivel. I have had some friends and patients who have used capsules early on, because then it's just lifting the capsule out. And if you've got the pram as well, so it just clips into the pram, clips into the car, and it's very easy to carry bub around within that as well. Nappy bags, same as with carrying, making sure that you've got a backpack type nappy bag, because we don't want to be carrying anything on one side that's going to drop things down. Nice thick straps. I actually had this model here, this grey one, fits everything in it, really comfortable, and again, some nice thick straps for all the carrying around that you're going to be doing with everything for bub. So what we've got from here is, in conclusion, sorry, clicking too many buttons, you know, having EDS and HSD can obviously present some challenges during pregnancy, birth, and parenting. However, with all of these types of discussions, careful planning, you know, chatting with your medical and healthcare team, you can be prepared for all of these things I've talked about, and what Sally and Melissa will talk about as well. And hopefully we will really limit those complications and issues with pregnancy, birth, and postpartum care. I have lots of ranges of references here, and thank you all very much for listening.